Okay. So we're going to go ahead and get started. We are going to talk today about depression. I'm Brittany. I'm a licensed professional counselor here in Washburn, but I am here representing the Auxilia Initiative, a nonprofit here in town. I'm going to talk just a little bit about that. My clicker doesn't want to work here. There we go. All right, so the Auxilia Initiative is a nonprofit that serves Ashland and Bayfield County. I'm right in your way. And we focus on resiliency training for first responders, mental health education for community members, coping skills for students. We also focus on early intervention. We provide group and brief individual EMDR for first responders and for community members following a crisis. All of our services are volunteer, and our therapists volunteer their time to provide free services to community members. Okay. So what we're going to talk about today is depression. We're going to learn what depression is, what it looks like, and what to do about it. So our agenda is to talk about symptoms of depression, the origins of depression, treating depression, and then some practical tools. Okay. So we're going to talk about the actual depressive disorders that come out of the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition. This is kind of like the therapist's Bible. So we're going to talk about what are the symptoms, what are kind of the criteria you have to meet in order to get diagnosed with a depressive disorder, and what do these different depressive disorders look like? What can they look like? So major depressive disorder, this is the most common depressive disorder you might see. This is what we kind of think of when we typically hear depression. This can look a lot of different ways, but in order to get diagnosed with major depressive disorder, what we're looking for is 5 or more of these symptoms. We're looking for depressed mood, a loss of interest or pleasure in the things that you used to like doing, an increase or decrease in weight or appetite, insomnia or hypersomnia, so either sleeping too much or sleeping too little, psychomotor agitation or retardation, so this is feeling kind of keyed up and on edge, or feeling kind of like you're walking through mud, like your body's just not moving a lot, fatigue, feelings of worthlessness or guilt, indecision or difficulty concentrating, and thoughts of death or suicide. Of those 5 things, 2 of them must be you have a depressed mood and you've lost interest or pleasure in things you used to do. In order for it to be major depressive disorder, you have to have those symptoms for at least 2 weeks in order for it to be a major depressive episode. It has to impair your functioning. It has to actually get in the way of you doing things that you would normally do. And it has to be most of the day, nearly every day for those 2 weeks. We all have bad days. We even have a bad couple days. But if we want to call it major depressive disorder, it has to be for at least 2 weeks, most of the day, nearly every day. The next depressive disorder I'm going to talk about is persistent depressive disorder, which used to be called dysthymic disorder or dysthymia. This is basically like a low level, constant, persistent depression. The difference between persistent depressive disorder and major depressive disorder is that major depressive disorder tends to have these episodes where you kind of have peaks and valleys, and persistent depressive disorder is more like a low valley all the time. So for persistent depressive disorder, the criteria are 2 or more of these symptoms. They're going to be very similar to major depressive disorder. The depressed mood, which is one that has to be met, poor appetite or overeating, the difficulty sleeping, low self-esteem, low energy or fatigue, hopelessness, indecision or difficulty concentrating. And in adults, this has to be a depressed mood most days for 2 years. This is again, that long-term kind of low valley persistent depression versus the peaks and valleys of major depressive episode. In children or teens, this is a depressed mood most of the days for 1 year. And because mood looks different in kids, this can also look like irritability, because irritability is often a sign of depression in kids and teens. The next one is disruptive mood dysregulation disorder, or DMDD. This is kind of a new one. This one hasn't been around that long. This is for kids. You can only diagnose someone between 6 and 18 years old with this diagnosis, and the symptoms have to have started before the age of 10. This diagnosis is kind of a way for people to catch kids who maybe didn't quite fit other things, because we know that kids do experience depression. It just looks different. And so this is a way for us to say, hey, something's going on with this kid, and they're having some depression and some irritability, and maybe that's even causing some behavioral challenges like outbursts and temper tantrums. So the symptoms of disruptive mood dysregulation disorder is an irritable or angry mood most of the day, nearly every day, temper outbursts that are out of proportion to the situation in frequency and duration. So not a normal temper tantrum, not a normal, I'm feeling dysregulated and I'm kind of having a hard time with the situation, but an actual, this feels way too big for the situation, and it feels like it's happening way too often, and it feels like it's happening for way too long. Temper outbursts that are out of proportion to the developmental level. You might see a kid and say, wow, that maybe seems like that would be happening for a kid who is 5 years younger than them. Why is this kid reacting in this way when they should be responding in a way that seems maybe more mature? Temper outbursts 3 or more times per week on average. And the symptoms have to be present for 12 or more months. That's a whole year with no more than 3 months of absent symptoms. So they really want to see that these kids are struggling long-term, not just having a rough patch. And then premenstrual dysphoric disorder, or PMDD, which is affecting women. This has to occur in the majority of menstrual cycles. The symptoms begin the week before menses and begin to improve a few days after the onset. One of these 4 symptoms have to be present, which is affective lability, which is kind of like mood swings. Basically, a lot of changes, rapid changes in affect or mood, irritability and anger, depressed mood, and anxiety. Decreased interest in things you normally would want to do, difficulty concentrating, lethargy, just like not having a lot of energy, appetite changes or cravings, difficulty sleeping, either too much or too little, again, a sense of being overwhelmed or out of control, and then physical symptoms like breast tenderness, swelling, joint or muscle pain, bloating, or weight gain. So this is the final depressive disorder that is listed in the DSM. And this is important to note because women are disproportionately affected by depression. When I have a woman in my office who is talking about some symptoms, and it might be PMDD, some of the things I hear are things like, I just want to break something, or I feel like I can't control myself. And that is something I call hormonal rage. And that is a good sign that someone might be experiencing PMDD. So please bear with my horrible drawing here. But this is kind of a way to visualize the different types of depression. So that purple line there, you have a baseline. This is somebody who's not experiencing depression or other mental health issues. Baseline does not mean that you don't have bad days. It doesn't mean you don't experience sadness or feelings of depression. It just means that the feelings you experience, you're able to tolerate them, you bounce back from them, your highs and lows are balancing each other out. Then if you come down here to persistent depressive disorder in the blue, it's like your baseline just got dropped down. Again, it's like a persistent valley, right? It just stays lower than your baseline. It doesn't really come back up to baseline, it just stays lower. And then you have major depressive disorder, which consists of episodes of at least 2 weeks of depressed mood. So those valleys here of depressed mood are at least 2 weeks of depressed symptoms. And then people do typically come back up to baseline again, and they feel better. Most people with major depressive disorder do experience more than one depressive episode. They may experience multiple depressive episodes in their life, but not always. Some people may experience one depressive episode and then not again. The example I like to use sometimes is working with teenage girls. A lot of the times they will experience depressive episodes during puberty because of their hormones. And so they might have these peaks and valleys while they are going through puberty. And then they might kind of level out and not experience that again. But if they were susceptible to that in puberty, they may experience another depressive episode when they enter perimenopause. Or they may experience depressive episodes again when they are in college and their boyfriend breaks up with them. So just because you have a depressive episode once doesn't mean you're going to continue to have depression, but it could come back in these episodes kind of on and off throughout time. So how often, how many people, what does this look like across America? So the average lifetime prevalence for males is 7.5%. So 7.5% of males will be impacted by depression. But if you look ahead at the increasing rates of depression, the projected cumulative lifetime risk is actually 20%. For pregnant women, 10% of pregnant women and women who have just given birth will experience depression. And then if we look at women in general, not just pregnant women, they have a 13.6% average lifetime prevalence. But again, if we look ahead at the increasing risk, their projected cumulative lifetime risk is 34%. So they are almost doubling what men have as far as lifetime prevalence. And then globally, 332 million people have depression. Rates are increasing and continue to increase. They're increasing among young people, and we did see a huge increase during the pandemic. So this is a problem that is impacting a lot of people across the world and across the US. So what causes depression? There's a lot of stuff up here, but okay.
Oh, sorry.
That's okay. There's a lot of stuff up here, but before I start talking about this, I would say that the easiest way to break this down is to say there is environmental causes and biological causes. So we can break it down further here, but there's stuff that's happening inside our body and stuff that's happening outside of our body. So there are stressful life events like losing a loved one or problems with your relationship. There are biological factors like genetics, family history. As far as family history goes, if you have a loved one, someone who is related to you, like a first relative related to you, you are 3 times more likely to have depression. Neurotransmitter imbalances, which we'll talk about in a minute, substance abuse, drug and alcohol abuse definitely exacerbate depression. Psychological factors like low self-esteem, pessimistic thinking patterns, rumination, childhood trauma. And then your brain structure and function, like abnormalities in your hippocampus or prefrontal cortex, traumatic brain injuries, damage to the brain. These are all things that can cause depression. So again, things that happen inside the body and things that happen outside the body, biological and environmental. So neurotransmitters, the biological, we often talk about as being the neurotransmitters in the brain. Biological can definitely be the damage to the hippocampus. It could be hormones for sure. But oftentimes we're talking about an imbalance in neurotransmitters. So the two likely culprits are serotonin and dopamine. We call these the happy hormones. Serotonin and dopamine are most likely responsible for those imbalances in the brain when someone has a chemical imbalance that's causing depression. Serotonin is known to be responsible for happiness, focus, and calm. And dopamine is responsible for rewards and motivation. They call dopamine the feel-good hormone. Dopamine tells you, hey, I liked that, do it again. Hey, that felt good, do it again. I liked that junk food, eat some more. It felt good when I went on that run. Let's do it again. It's responsible for that reward and motivation. But it's also responsible for lots of other things. Serotonin is responsible for your digestion and your appetite, your mood, your sleep, anxiety, blood clotting, sexual desire. And then dopamine is responsible for movement, memory, pleasurable reward and motivation, behavior and cognition, attention, sleep and arousal, mood, learning, adaptation. It's responsible for a lot of things. And what normally happens in the brain is serotonin and dopamine work together and they balance each other out. For example, serotonin is a hunger and appetite suppressant, and dopamine lets you know that you're hungry. But when they're not working together, things get off balance. And then we don't have the feel-good hormones that we need. And we don't have the happy hormones that we need. So this is where medication often comes into play. So we can talk now about what do we do? How do we treat depression? So there are lots of ways to treat depression. We're going to talk about different types of therapy and then medication. So behavioral therapy is one type of therapy. It targets behavior change, focuses on the relationship between behavior and mood. Basically, it's saying that there's a behavior that you have that is not working for you, it's not serving you very well, and how can we change that to improve your mood? Cognitive therapy is the same, but with thoughts, saying there's a thought that you have or these thinking patterns that you have that aren't helpful to you right now. How can we change that? Cognitive behavioral therapy is putting all of that together. And this is the one that is most often used with depression. Cognitive behavioral therapy says you have thoughts, feelings, and behaviors that are all interacting together. And how can we help you make that a healthier thought, feeling, and behavior so that we can improve your mood? Interpersonal therapy targets current problematic relationships and situations and sees how those might be impacting your depression. Then there's mindfulness-based cognitive therapy, which really just incorporates regular cognitive therapy with mindfulness-based skills and focuses on self-compassion. Supportive therapy, which is a lot more like talk therapy, offers a supportive and empathetic relationship and kind of helps you strengthen your ability to make choices and cope with your life. And then psychodynamic therapy, which isn't as common anymore, but it's still around, targets current problems and focuses on identifying patterns in life. You might focus on unconscious thoughts and early experiences. So what we know about therapy for depression is that it is very effective. The most effective is cognitive behavioral therapy. That's kind of our go-to. But we also know that medication is very effective for treating depression. But the most effective is a combination of therapy and medication. Some people can't access that right now. I know there's wait lists for therapy, or some people can't get into the doctor, or they choose not to take medication. And so one or the other sometimes is what works best for people, but a combination of the two is really what studies have shown to be the most effective for treating depression. So there are a couple of different kinds of medications for depression. There's SSRIs, which is selective serotonin reuptake inhibitors, SNRIs, serotonin norepinephrine reuptake inhibitors, and NDRIs, which is norepinephrine dopamine reuptake inhibitors. So you might notice some of those words were those neurotransmitters we talked about. And so those medications are working with your brain to try and allow those feel-good hormones, those happy hormones, to actually be viable in your brain. Okay, so what do? So now you have all of this information that I just spewed at you. What do you do now if you are struggling with depression? Okay, so I'm going to talk a little bit about cognitive distortions. So cognitive distortions are thinking errors or thoughts that are not rational or logical. We all have cognitive distortions. We have them pretty regularly. But when we're experiencing depression, we have them much more often, and they're harder for us to kind of swerve away from. So if I'm having a thinking error, an irrational thought, like everybody's staring at the zit on my face, that's not a rational thought. That's coming from this place back here in my brain that's not true, right? But if I am not experiencing depression, I can really quickly say, no, Brittany, that is not true. People are not staring at the zit on your face, right? But if I am struggling with depression, it is very hard to challenge that thought. My depression is actually going to say, yeah, I think they are. And also, aren't you just an ugly witch, right? That is what depression wants to tell you. So these cognitive distortions are irrational thoughts, they're thinking errors. And when you have depression, they are going to dig their claws into you and really want to make you believe them. So these are some different kinds. There's black and white or all or nothing thinking, which is where you look at things in absolute black and white categories. The example I give for this is usually, I got a 95 on the test, I failed. It wasn't 100, I failed. Overgeneralizing, you view a negative event as a never-ending pattern of defeat. I burned my toast this morning, my whole day is ruined. That one thing, my whole day is ruined. Mental filters are dwelling on the negatives and ignoring the positives. I'm giving this presentation and it's going well, but I stumbled over my words and that's all I'm going to think about tonight. It's that one thing. Discounting the positive is insisting that your accomplishments or positive qualities don't count. I didn't get a good grade on that paper because I worked hard. I got a good grade because the teacher's easy. It has nothing to do with me. Mind reading is assuming that people are reacting negatively to you when there's no definite evidence for this. The zit on my face, right? Everybody's staring at the zit on my face. I have no evidence for that. Or I walk into a group of friends and they don't immediately stop talking to say hi. They must be mad at me. Fortune telling is arbitrarily predicting things will turn out badly. I just know if I go to that party, I'm going to have a terrible time. Magnification and minimization is blowing things way out of proportion or shrinking their importance inappropriately. I stubbed my toe. It's going to get infected. I'm going to have my whole foot cut off, right? Emotional reasoning is reasoning from how you feel. I feel stupid, so I must be stupid. Shoulds and musts is you criticize yourself or other people with shoulds. Now, these aren't appropriate shoulds, right? I should not kill people, right? That is not something that we want to stay away from, but I should be happy all the time. I should want to make dinner for my kids every single night because I love them so much. Right? That's not realistic. These shoulds that we're criticizing ourselves with that can really be damaging to us. Personalization and blame is you identify with your shortcomings. So instead of saying, I made a mistake, It's, I'm an idiot. Right? And then labeling is you blame yourself for something you weren't entirely responsible for, or blaming other people, but that's less common. This would be something like, I ran into my friend and she was kind of short with me, and I just know it's my fault, even though I haven't talked to her all day. Right? So I'm telling you about these cognitive distortions because they are such a prevalent part of depression. And I want to tell you what to do about them because this is a practical tip that just needed a little bit of background before we could do something about it. So this is the cognitive triangle. This is that cognitive behavioral therapy that I was talking about. The cognitive triangle says that thoughts, feelings, and behaviors are all connected. They have these two-way arrows that connect them, meaning that one does not cause the other. They're all interrelated. If we change one, we change the others. So when we have these distorted thoughts, they're also distorting our behaviors and our feelings as well. And so if we want to try to change how we feel, we don't want to feel depressed, we need to change our behavior or our thoughts. So, for example, if I'm having this distorted thought that says, when I wake up feeling depressed and fatigued, I think to myself, I'm never going to feel normal. My behavior is probably going to be, I stay in bed because I feel hopeless. And now we have this cycle that just keeps going, right? Because our feelings, our thoughts, and our behavior are all connected. So if we want to change that, we need to come up with a different thought. So I can come up with a thought, something like, I can do something for myself today, even if I don't feel good. Now, what I like to tell people is this thought does not have to be groundbreaking. It does not have to be the complete opposite of the original thought. If your first thought is, I'm the ugliest person in the world, you don't want to say, no, I'm the most beautiful person in the world, because your brain is going to go, bull crap, that's not true. You have to have a thought that you can buy into. You need to be able to at least get a little bit of buy-in, even if you don't 100% believe it right now. So instead of I'm never going to feel normal, I'm not going to tell myself, yeah, get out of bed and you're going to be like Superman. No, I'm going to tell myself I can do something for myself today, even if I don't feel good. And then my feeling is probably going to be hopeful. I'm not all of a sudden going to not be depressed. That's still going to be there, but I'm going to feel a little bit more hopeful. And then my behavior, maybe I get up and take a shower. Or maybe I roll out of bed and watch some funny TikToks, something. And now we have a little bit better of a cycle happening, much better than this. So for anybody who is thinking about this, just think about what are those cognitive distortions you have? What is that voice in your head telling you when you're depressed? And how can you change it? How can you challenge that thought to have a different feeling and a different behavior? So now we're going to talk about how to change the behavior. We know that we have this depressed feeling, or angry, or hopeless. And we talked about how to change the thought, but now we can talk about how to change the behavior. This is called behavioral activation. And this is basically the process of having a different cycle of behavior, because what's happening right now isn't really working for you. Right now, what's happening is you feel low, so you stop doing things that matter, so you get less out of life. And then because you're getting less out of life, you feel more low. So you really stop doing things that matter. So you get even less out of life. And this is like a big giant ball rolling down a hill that just keeps collecting steam on its way down. And we want to stop that. We want to stop the momentum on that ball. And so the only way to do that is to reverse direction. We have to do something different. So if we do more of what matters, we will feel better and we will get more out of life. So if I give an example of I'm feeling low, I stop doing things that matter. Maybe I stop texting my friends. I've stopped doing the dishes. I'm eating off of only paper plates and plastic silverware. And I've stopped paying my bills, even though I have money in my account. I'm getting less out of life. My friends aren't around and I have nobody to cheer me up. And the dishes are looking pretty grimy. Now I feel really crappy because I'm looking over there and my house is trash. And because I haven't reached out to my friends, they aren't reaching out to me. So now I've really stopped doing things that matter and I really feel crappy. Right? So in order to do more of what matters, I need to do something different. And it might just be I text my friend. I don't have to go hang out. I don't have to like throw a party. I don't have to clean my whole house or pay all the bills, but I just need to do a little bit of something, just a small thing. And maybe I just text my friend and say, hey, what's up? Or maybe I go and I take all my dishes out of the sink. I don't have to wash them. Or maybe I get the mail. I don't have to pay those bills. I just need to get the mail. And the more you do, the better you will feel and the more you will get out of life and the more you will be able to do. The more you do, the easier it is to do. And I know that is hard. And anybody who has ever been depressed will tell me it's not that easy. So this is my saying, sorry, Nike, when I talk to people who are experiencing depression is just do it. Whatever it is that you need to do to get out of that place, just do it. You're not going to want to. I have no magic pill or magic wand to help you feel motivated to do it. That first little thing that needs to happen to get the ball rolling in the other direction, just do it. Do it sad, do it unmotivated, do it in your sweatpants, do it with greasy hair. Just do it. So oftentimes, if people don't know where to start, I will say pick 3 things, put them on your menu. These are your choices. And then go off in your week and try to do one of those 3 things at least once. In these different categories, there are social activities like texting a friend or going to the store and saying hi to the cashier. Achievement like practicing an instrument or checking your bank statements. Get something done. Feel good about yourself. Physical things like going for a walk or even making a healthy meal. And then things just for enjoyment, like listening to music or playing with your pet. We need balance and we need to do things that we enjoy, that are pleasurable to us, and we need to take care of our responsibilities. We have to find joy, and we also can't let the bills pile up because we will never get out of that funk if we can't look our bills, our dishes, our bedroom in the face. Okay, so here are other practical tips. Sleep. We need sleep. Practice good sleep hygiene and get into a regular sleep routine. I have a slide on that next. You'll see the little happy light there. If you don't know what a happy light is, you should get one. It is a device you can set up on your table, on your bedside, anywhere. And is fake sunlight, basically, and it allows us to get what we need in the winter months so that we can feel better. Because seasonal depression is also a real thing. And when we use a happy light, we are much less likely to experience seasonal depression. Exercise, regular exercise does help reduce stress, improve mood, and it releases endorphins. And those endorphins are happy hormones. We want those. Nutrition also does play a role. There have actually been some really interesting studies about what nutrition helps support depression. Even things like getting enough protein in the morning and before bed. It's actually quite a bit of protein that's needed. But if you're interested in that, I would definitely recommend that you go do some research about what your specific body might need as far as nutrition and protein in particular in order to support depression. And then sunlight, daily sun exposure reduces depression and improves mood. Get outside. And in the winter, get a happy light. Okay, so sleep hygiene. These are some things that can help us sleep better. Sleep, 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 sleep. If our sleep is bad, our mood is bad. Our brain health requires sleep. So keep a consistent wake and sleep time. Go to bed at the same time, wake up at the same time. Even if you like to sleep in on the weekends, go to bed at the same time, wake up at the same time. Keep a regular daytime routine. We are on a 24-hour circadian rhythm, which means that our bodies really like to know what's happening next. If you eat lunch at the same time every day at work, and then on the weekend, all of a sudden you're really hungry, that's because your body is so keyed in to knowing what to expect next. It's the same thing at bedtime. We are really, really tuned in to this 24-hour rhythm. So keep as much of a routine as you can. Only sleep when you're sleepy. We want to train our brains to fall asleep in bed. Your bed should only be for sleeping, and the other thing I'm not going to mention. So sleep when you're sleepy. When you lay down in bed, your brain should say, I'm tired, I'm going to sleep. And if you go to bed when you are wide awake and you can't sleep, you're telling your brain, my bed is for hanging out and staring at the ceiling. So only go to sleep when you are sleeping. If you cannot sleep, after 20 minutes, get up and do something else. Go stretch, go read a boring book, go take a warm shower, and then try again. Do not lay in bed for more than 20 minutes just staring at the ceiling. Again, we're training our brain to be in bed sleeping. Exercise and eat right. Have a dark and cool bedroom, and also keep your bedroom tidy. When our bedroom is cluttered, it makes our brain not want to be in there, and it makes our brain stressed out. If you take a hot shower or bath before bed, within the hour before bed, what happens is our body temperature raises, and then while our body is trying to cool ourselves off, it actually makes us sleepy because our body's working so hard to cool our temperature off. And then try something like yoga or reading or mindfulness. And then some things to avoid, no naps. I like to think of naps and sleep as like you have a tired tank. And when you wake up in the morning, your tired tank is empty. You've just slept. And throughout the day, your tank gets filled up with like tired juice. You can tell I work with kids. And the tired juice gets full by the end of the night so that you can go to bed. But if you take a nap, you deplete your tank of tired juice. You don't just drain it a little bit, it gets wiped out. And that's why naps are so detrimental to people, because you don't just take a little bit out, the whole thing gets drained. And so if you are going to take a nap, do it before 1 or 2 in the afternoon and make it 30 minutes. If you can do that, great, go ahead. But we really don't want to be taking naps unless we are sick. Avoid caffeine, alcohol, and nicotine for at least 4 to 6 hours before bed. Some places say 10 hours before bed. Don't watch the clock, and no screens for at least an hour before bed. All right, other practical tools. Mindfulness. Everybody's probably heard mindfulness and they're probably really sick of hearing mindfulness, but mindfulness is a great tool for depression. It does not have to be mindfulness on your phone or your computer. It can be something like go for a walk and notice the color of the leaves. Get outside and just look around. What am I seeing? What am I hearing? Mindful eating. Eat something sour or juicy and take time to notice how it tastes and feels in your mouth. And then if you want to, you can use an app or go online, find a short video and follow along. This is the app I recommend. I should be sponsored by them. I would have given them a lot of money, but they don't. I haven't asked, but maybe they will. This is the Simple Habit app. I have the name written there, Simple Habit app. It is free. You should not have to pay for mindfulness. The QR code is there. And the reason I like this app is because you can go, if you go to the bottom where it says meditate, then there's something called on the go. And that on the go section, you can go and say I have 5, 10, or 20 minutes. So you can decide how long you're going to take. And then you can pick what's going on for me right now. I have a big event, or I'm going for a walk, or I'm trying to sleep, or maybe these two here are often used, SOS or tough day. And then it will give you one more time to choose. So this is the circle that said SOS. You can say, okay, I'm having a panic attack, I'm in pain, I'm frustrated, I'm nervous, or I'm depressed. You click on that and it starts your mindfulness exercise. The reason I like this is because you can go to YouTube or Google, type in mindfulness, and you have all these options and you have to sort through and try and decide what is going to be good for me right now. One of them is 2 minutes long, one of them is an hour long. One of them is not actually mindfulness, it's just somebody talking about something. And this is all mindfulness exercises, and it's going to be exactly what you need at that moment. So I would really recommend this, especially because if you are struggling with depression, there are going to be times in your day where you just need this break. Okay, so we're going to recap. Do more things that feel good. If you take anything from this, do more things that feel good. If you do things that matter, you're going to get more out of life and you're going to feel better. Anything you enjoy. Move your body and your mind. Exercise, nutrition, sleep, mindfulness. And again, the more you do, the easier it will be. Just do it. And professional help is available. Therapy and medication combined is proven to be the most beneficial. There are resources available. I have a slide coming up next, and I also have QR codes up there at the back. So these here are QR codes that will take you to the community resource brochure that has been put together by maybe the hospital, I'm not sure, someone in the community. And it has access to mental health therapists, psychiatrists, different social services in the community. And then this outpatient mental health resource here is something that I put together that has the different outpatient therapists in the community, and also who is trained in EMDR, who sees kids, things like that. And that is it. Any questions?
Not to keep us here any longer, but the one question that came into my
Yeah.
mind was, is there anything somebody can do to, and I don't know that they would want to, but can you prevent depression? Is there something you can do ahead of time, or is it something you have to deal with when it happens?
Yeah. So I think there's two things that come to mind when you say that. One is resilience. And so there is definitely something to be said about people being resilient. And there are protective factors against things like suicide and things like that. I don't think that you could necessarily say, do this and you won't get depression, right?
Okay.
But there are things that help. All of the things that we talked about today are things that would be protective factors against depression. Challenging negative thoughts, exercising, eating well, getting sunlight, all of these things would be protective factors against depression. The other thing though, is that I'm going to go back to this slide. When someone is here and they start to notice, I think things are not feeling so great for me right now. This is a great place for people to start doing these things we've talked about. So a lot of the work that we do in therapy with people who have depression is we say, what's happening right here before you go into this episode? Because that is a place where we can start using these skills and tools. And sometimes it's not that we can avoid the episode. Sometimes we can, but we can definitely take it from going like this and we can make it maybe go like that, right? So it's not necessarily that we're gonna prevent someone from getting depression, but we can make those episodes shorter and smaller, less severe. And sometimes we can even say, oh, I think I've got this episode coming on. And we might even be able to prevent that from happening in the first place. Most of the time, though, these are people who have already had depression and have experience with that. Yeah. Yeah, but that's a great